All right. I do just welcome everybody. I think I have everyone set up good to go. I do just want to send out, I would know is making this announcement a few times. I do have cameras turned off. I do have the audio turned off, except for myself and the agents who will be joining. If at any period of time you have any questions and you're actually on a laptop or iPad, you should be able to put that into the chat section. I do thank you for joining us. I am going to give it another minute or two here. If you are joining by phone, I do have a presentation that I am putting on screen. I will be sending everything out in a recording via email, but I do ask if you are joining us today, feel free to stay. That way you can ask questions in live time and we can get those answered. I do just want to remind everybody though that if there is anything that seemed a little confusing, a little overwhelming, or you want clarity on, or just wanted to make sure that you understood it correctly, please reach out to the agent that you're working with or be happy to help answer this. I'm just going to give it 1 minute here. I'm going to be respectful of all of your time. I just want to get anyone who may be coming in a little late. That way we can get the ball rolling and get everybody on the same page. So just bear with me a few more seconds here and we'll get everything set up and good to go. All right, I'm going to get started. Welcome, everybody. Thank you very much for joining us for the Health Focus Partners 2025 Medicare presentation. For those of you who don't know who I am, I'm Patrick Snell. I am the president of Health Focus Partners Agency. I'm going to be the one conducting today's meeting. I just want to go over a lot of our big changes that are happening for this next year. If anyone, again, has any questions, feel free to ask in the chat if you have that capability, or reach out to your agent by email or telephone, text, however that is you work with them, to get some clarity, have any of your questions answered. I do want to start by saying thank you very much. I appreciate your trust working with one of our agents. It means the world to me. We did all take this role very, very serious, and I really appreciate the support that you guys have provided the agency. I know and understand, and I know Tony and all the agents who are joining us today understand that healthcare, especially for the Medicare population, is one of the most important decisions one can make. And we do, take that very serious with working with you. We want to make sure our clients are educated. We really, truly, it's a theme I drive home with them that we are not salespeople, even though technically we are. We are educators, and the sales just happen to be, a consequence of that all. And that's something we try to instill within our agency, which is why we like to think of ourselves as a safe haven for insurance shopping. So again, thank you for that support. Reminder, videos are turned off, audio is turned off, but you should have the capabilities to put in chat if needed. I do want to keep everyone's time here today. On this under 30 minutes as best as we can. If anyone wants to stay on, has questions, I will give you a few moments and I will stay on the chat and help answer that. But for as far as our agenda today, we're going to be talking about a few items. There is a lot of big changes coming to Medicare for 2025. A lot of that is surrounding the Inflation Reduction Act. We'll talk about that in a little bit and how that's impacting the Part D program of Medicare, okay? And when we talk about the Part D program of Medicare, that doesn't just mean the standalone Part D drug plans, that also includes individuals who have Medicare Advantage prescription drug plans, okay? So when we talk about Medicare Advantage, if you get your prescriptions through that program, that's a Part D plan that's embedded into it. So therefore, it also impacts that. We'll talk about the annual notice of changes where you can find out information about your current plan, and then some of what we're doing here to kind of help make next year a little bit easier. If you're not familiar with me, it's because you may work with one of the individuals on the screen. We have Tony Saby, we have Kurt Robinson, Kimberly Hook, and Stacy Robinson. They're all agents within Health Focus Partners who focus primarily in the world of Medicare and also other health insurance products. I do want to thank them very much. I know it seems that this job is sometimes just plugging in information and boom, out shoots the plan. But it's a lot more than that. These guys take their role very, very serious. There's a lot of credentialing that's needed. There's a lot of licensing that's needed. A lot of federal changes that's constantly happening that we have to be up to date on. And these guys do a great job staying up to date on that. I want you all to be very aware that once something comes out, I think we all collectively come together and we say, hey, how does this not only impact the Medicare industry as a whole, but really how does it impact our current clients? And that's the focus and that's the decisions we make. Don't get me wrong, we always love taking on new clients, but what we really try to hone in on is for the retention of our current clients, making them understand the programs they're in, the insurance products that are available to them, and answering any questions, being available as well. So if it's me again that doesn't look familiar, it's because you work with one of these fine folks. They do a great job, with their job. So please utilize them as a resource because they are full of great information there. So to kind of touch base here on really the subject and probably why the vast majority of you are joining is what's changing for next year. And we can't talk about that change without talking about the Inflation Reduction Act. The Inflation Reduction Act is really what's implementing everything that has been changing in the way of Medicare for the past few years. It was signed by President Biden in 2022. There was a lot of moving parts with the Inflation Reduction Act. It wasn't just for Medicare, it wasn't just for healthcare, but part of that package, like every bill, right, where there's other things included into it, was to focus on the outrageous pricing of prescriptions, how to keep that market stable, how to focus on giving Medicare more legal authority as being able to actually negotiate drug prices, which they never had that, legal authority in the past to do. And for some of you, you may have already experienced these changes in impacts of the Inflation Reduction Act without even knowing it. It started with the $35 cap on the insulin. That was really the first big movement in the world of Medicare and the Inflation Reduction Act. It then moved to help expand the Extra Help program, which is a federal program through Social Security for individuals who meet income and resource limitations. Again, it gave Medicare that power, that authority to start actually hosting communications, I guess we could say, with drug manufacturers for a lot of our more commonly expensive drugs to help set those costs, bring those costs down, and work with the manufacturer directly to make that happen. While at the same time, and maybe some of you have experienced this and some of you have not, is keep certain drug prices low and not go up with the actual hike of inflation, which, for every other product, you've experienced that. With prescriptions, there's been a little bit of a steady federal regulation to help prevent that, right? To not make that so outrageous. But really, the big focus is not what has happened, because that's still all going to occur. What we're looking at is what's going to occur for 2025. And there's really two big changes. And the first change is the fact that there is now a maximum out of pocket limit of $2,000 for prescriptions. I'm sure many of you have seen this on the news. I can't really watch the news without seeing it myself, so I'm sure you all have as well. This is a really great thing for a consumer, right? Where we're going to have a new $2,000 maximum out of pocket. And for some who's on this call and webinar, they may say, well, you know, I'm not spending it anywhere close to that. Yes, that's absolutely great. We love that that's the case for you. I think that means you and your agent are doing a great job at your healthcare choices. But for many, they are taking prescriptions where they may be meeting this in January. They maybe have been surpassing this in January. But with this, I'm going to talk about a little bit of the pros and cons we may see with this. So it's an important factor. It's great for consumers long term, but like anything, there's always the unintentional consequence of things, and I'll touch base on that here. And then also a new Medicare prescription payment plan. Obviously, I know many of you have gotten the email, hence why you're on today's webinar. We've also been sending out letters. I do want to make this very clear because I think there's been a little confusion. The Medicare prescription payment plan, and I'll touch base on this again, is not anything separate. It's going to be part of your plan. It's an option within the plan you and your agent have decided on. I just want to kind of explain what that program all means. But first, we're going to talk about the $2,000 maximum out of pocket, and that means there is no more donut hole. It has gone away. If you're sitting there scratching your head and saying, "Hey, I know Patrick, Tony, Kim, Stacy, Kurt, whomever told me about this donut hole, I don't never experienced it," well, then count your blessings, because when people were hitting this donut hole, they were paying a lot of money to hit it. And then once in it, they were responsible for 25% of their drug cost until they reached $8,000. It is going bye-bye. This is why we have the $2,000 maximum out of pocket now. So once the $2,000 is met, you spend no more in a calendar year. What's very important about this, though, is a big something to keep in mind as we focus on the annual enrollment period is that $2,000 is for prescription drugs covered in the Part D realm, meaning it has to be billed through the Part D program, not Part B drugs that may be administered by a doctor. And it must be covered medications, right? It's not a collection of things. So for individuals who may be getting prescriptions through Canada, who are utilizing GoodRx, who are utilizing manufacturing coupons, it's not adding to this amount. It's not adding to this amount at all. It must be billed through the Part D plan for it to reach this $2,000. There are some of you out there that I know from working with you, whether that's been a few months to a few years or the entire time you've been on Medicare or maybe even before, that were reaching the donut hole in February. Some of you even in January. This is going to be a really good thing long term. It's going to save some consumers thousands and thousands of dollars. But I think my role and the agent's role into this is just kind of having that conversation with you of thinking about what this may mean unintentionally, right? At the same time, the federal government has stepped in and said, "Hey, we're not going to allow a consumer to spend any more than $2,000 on drugs." So you as the insurance carrier and the manufacturer, you have to pay more out of pocket. And from us, everyone who's in this webinar, I think even us agents can say, well, hey, that's fine. They're worth billions of dollars. They can afford to pay this. We agree with you on that. The problem is these are for-profit companies. And prior to 2025's changes, the federal government was coming in and helping subsidize these changes. They were helping come in and helping pay a portion when individuals were reaching the donut hole. They were reaching their catastrophic stage. The federal government said, no more. We're not paying for that anymore. So not only is the insurance company having to not allow much of a consumer, which we're all fine for, but they're not helping getting paid on the back end. So what are maybe some unintentional consequences of this? And what I'm going to say here is not applicable to every single person. And we'll touch base on how you guys can help figure this out on your own, through what's the annual notice of change. But maybe we're going to start seeing deductibles where there weren't deductibles before. Maybe we start seeing deductibles on certain drugs where there weren't deductibles before. Maybe we start seeing certain drugs not be covered when they were before. Or maybe they were a tier two and now they're going to be a tier three or maybe even a tier four prescription. That some of that information, even us as an agent, licensed insurance agents who work closely with the insurers, we won't know that until October. They just legally can't release certain information to us come until October 1st. But there will be those changes. And that's why more than any year past, we have been sending out a lot more letters, a lot more emails to help prepare for this, right? So why I know I have personally been hearing from individuals, hey, I'm happy with the changes. That's all fine. There's nothing wrong with that. You can stick with your plan. There's nothing you need to do to make that happen as long as the plan's remaining available for next year. But what I can't guarantee until October is was the drugs all going to be set the same? Right? Were what you paying before going to be what you're paying next year? Because with these unintentional consequences, right, it could be that the actual individuals who are paying less for prescriptions are now paying a little bit more. We may see where there was once a copayment, it may now be a coinsurance. And again, this is not every plan. This is not every plan that's going to be out there. But if it's moving from a co-payment to a co-insurance where you're starting to pay a percentage, well, that may be a little bit more higher out-of-pocket cost. So while this is well intended, and there will be huge number of Americans out there who will benefit from this rule, there will also be that number of individuals who will see an impact to this that may seem relatively negative, right? We may see insurers help compensate their losses with higher co-payments elsewhere, or maybe a reduction in an ancillary product. But I want to make something very, very clear here. This is happening for every plan, for every insurance carrier across the country. This is a federal law. No one is immune to it. I think I'm speaking here a little off of what I intended to tell you, that Medicare's long-term objective is to put the insurers back on track to remind them that this is about healthcare and helping keep the healthcare costs low and helping keep prescription costs low. We have been, especially individuals who are in Pennsylvania, which is going to be the vast majority of you, we have been especially spoiled in our state, and we probably will be continue to be spoiled in our state in the grand scheme of things. But it doesn't necessarily mean year after year where we have experienced this. Well, there is actually greener grass on the other side, right? Those days may be coming to an end. And I'm not saying that as a scary thing. I want you to be prepared, right? I want you to know, and I'll give you guys the ability to see this yourself, but I want you to know what may be occurring here. So no more donut hole is an absolutely great thing, which means we are reducing the stages of a Part D plan. Again, this is whether you are in a Medicare Advantage or a standalone prescription drug plan. We don't have, the donut hole anymore. We go right into your deductible. You may have one when you didn't before. Maybe you have one, but it's only applicable to certain prescriptions. Maybe you're in a plan that doesn't have one at all. But if there is one, that is stage one. You must meet your deductible. After that is met, or when it needs to be met, you move into your initial stage with the co-payments or co-insurances. After that has been met and you have reached $2,000 in your out-of-pocket expenditure, you now move to the catastrophic stage. And for that period of time, you have no further cost for the remainder of the calendar year. Come January 1st of the following year, no matter when you get into Medicare or we're into Medicare, everything will reset itself. So where there was once 4 stages, now we have it to 3, and the numbers have changed. Positive impact for most here. Okay. Going back to another change for 2025 that we were briefly touching on was the Medicare prescription payment plan. This is very unique. It took a little bit for CMS, who is the federal regulatory body of Medicare, to provide a little bit more guidance on this. It took insurers even a little bit longer to interpret the rules of it. But overall, everything here seems to be consistent among the insurance companies. And the Medicare prescription payment program is offered by every plan that offers prescription drug plans. Okay. So if you're on a standalone Cigna prescription drug plan, or you're on a Aetna Medicare Advantage plan that has drugs included, you are offered this program. It is not required for any member to join the Medicare prescription payment program. You can opt into it prior to the year, or you can opt into it at any point in the year. But what the program is this: you don't pay at the pharmacy. What you would end up getting bill, well, what you would end up paying is a bill from the health plan or drug plan directly for what you would have paid at the pharmacy. So if we want to just make this easy numbers here, if you went in January to pick up all of your prescriptions, and just for example purposes, the grand total would have cost you $1,200 at the pharmacy, you don't pay that at the pharmacy. Now they're going to take that $1,200 and divide it by the months of the year. And they're going to say, hey, you now owe $100 per month, and that will be billed to you by your insurance company or drug plan, whichever, health plan or drug plan, whichever product you have. And you must make that every single month. And for some, that's great. right? If you have an individual who's meeting their maximum out of pocket right away of $2,000 and they're going to the pharmacy and not required to pay that 2000 and can spread that 2000 over the course of the year and have no more further prescription costs because they've hit their maximum, may work out well for them, right? So, is this required? No. But as you get annual notices of changes, which we'll touch base on here, as you get more information for your insurance company, if you're switching plans, this is something for you to consider to opt into. Okay. It's not, you're not opted into it and you need to opt out. You must opt into it yourself. So, unless you do that until you do that, you will be billed at the pharmacy just like you were before, but depending on your drug plan or health plan and how that is set up going forward. So I try to do a little bit of a demonstration here, or a type out, I should say, the calculation is that the monthly bill is based on what you would have paid for prescriptions plus any previous month's balance plus the number of months left in the year. So I want everyone to think of that. If you go in January and you would have paid $500, let's say you, for I don't X amount of prescriptions, and it was a 90-day supply, then you get 500 divided by 12, and that's your bill or each month. But then you go back in April, and there's another $500. Well, they're adding that 500 off the remaining months again, and they're adding it to what would have been still owed from January's monthly bills. Then you go back 3 months later and you're picking up another 90-day supply at $500. That's going to be added yet again to your bill, but over the remaining course of the month. So for individuals that may have lower cost, it may not necessarily be right for them, which is ultimately the question of, is this right for everybody? And I'm going to probably tell you, no, it's not going to be right for the vast majority of you. This is your right in Medicare to join this as long as you're a member of a prescription drug plan or a Medicare Advantage plan. I don't want to ever tell anyone to not take advantage of a opportunity or right they're given through federal law and regulations, but I want you to consider the potential consequence. If going back to that $500 every 3 months, you get now in September or October and you picked up another 500, they're calculating that on the bill you already had. And now that needs to be paid by the end of this year, okay, or the end of the calendar year, right? It can make those monthly premiums go up. So who is not right for this? If you're a member of the Extra Help program, this is not a good program for you. Okay, you'd be better off paying your prescriptions at the time of the pharmacy. If you are a member of PACE or PACE-Net, this is not a good program for you, right? You're better off picking this up, paying what you're paying at the pharmacy. If your prescriptions are relatively inexpensive, this is probably not a good program for you, right? Because you're going to make those monthly bills more towards the later end of the year much higher than just paying it at the actual pharmacy. Again, who I think this really benefits is those initial people who are getting close to their maximum out of pockets in that first 4 or so months of the year that can spread that 2000 or X amount of dollars out through the remaining portion of that year. Because the question is, does this save money for the consumer? And the answer is no. You're just breaking up how you pay it. You're not breaking up what you pay. So I know from the different insurance carriers, we've been getting, their enrollment guides coming in. We've been getting some of the information that's being sent out to their current consumers. There's a lot of detailed information on there regarding the Medicare prescription drug payment program. I encourage you all to read it. I'm trying to put it into a nutshell, but a very informative nutshell for you. But I want you to think about, is it right for you? And if the question is, well, it may not be, well, then the answer is probably it's not right for you, right? And we as an agent do not have a way of calculating that out. We can give you what your estimated cost would be for next year. We can give you a time frame of where you may, in a monthly wise, spend those payments at the pharmacy, but to calculate and say, well, your estimated monthly bill each month may be this, we have no way of doing that. Right? There's no system. The insurance carriers will not know until the time the pharmacy actually issues the order. So something worth considering, especially for individuals taking higher cost prescriptions. This may be a right fit for you. If you're not and you're not in that realm, well, then maybe not for you, right? And again, in the event you do get prescribed a costly prescription mid-year, you can always opt into the program, right? You can always opt into the program, but you must make those monthly bills each month. In the event you don't, and you stop making those payments for any reason, you will be kicked off the program and you will be required to pay the full amount owed. You won't be kicked off of your plan, but you will be kicked off the program and you'll be required to pay the full amount. Okay. How can you find out how your plan's changing as in it relates to that deductible and your co-payments and your co-insurances that I was all telling you about? Well, first and foremost, through the annual notice of change. Okay. The annual notice of change is being sent out from your insurance carriers. Many of you may have received it. If you have not, that's okay. That doesn't mean anything. They have to have it out to you by September 30th. Please, please, please pay close attention to your annual notice of change. I know it reads as a big legal document, but in the grand scheme of things, it's really two columns showing you how it is this year versus how it will be next year. It's showing you everything from premium changes to co-payment changes to how drugs may fit in different tier structures to are there deductibles, are there not. It will show you if there's even changes to dental, vision, hearing, all of that things if you have plans that incorporate it. Who does not receive this? Medicare supplement individuals. If you are a Medicare supplement plan holder, you will not get an annual notice of change. Why? Well, because Medicare supplement does not change. It remains the same year after year. The only thing that changes about Medicare supplement is normally the premium that's involved. So please review your annual notice of changes. It allows us also to be able to communicate with you much better of what to expect. If there's any confusion relating to reading them, always reach out to your agent or myself if I am your agent, and we'd be happy to kind of go over that with you, or I should say decipher the legal lingos and jargon that may be used in there. I think something that's really important though is for you guys to consider for this upcoming annual enrollment period with all of these changes, the impacts, and once you're reviewing your annual notice of changes, what's important to you, right? I try to reiterate earlier that, this may be years and we may start seeing this where that grass isn't always going to be greener, right? There may not be where there's going to be that $2,000 dental or, you know, uh, prescription drug plan that I know is popular that's 50 cents may not always be the hottest thing on the market, right? Even if you are taking no prescriptions, well, there's nothing worse as an insurance agent getting that call saying, but I now was prescribed a prescription and they don't cover it, right? There's nothing worse than that. Our job is to help kind of not foresee the future, but prepare for the future with you. And sometimes there's a little bit of a cost associated with that. But I really want you to focus on these next few, weeks of why we approach annual enrollment periods. What's important to you? If your current plan's checking off all the boxes, well, hey, nothing wrong. Stay with where you're at. We're not telling anyone they need to shop or they must shop. We want you to know what's changing as far as regulation and how this may impact changes, right? Maybe that emergency room copayment's a little higher than it was last year. But you know what? Maybe it's going to be the same across the board. Okay, so something for you to kind of consider here and then work with your agent to kind of help decipher of can I still get a plan or is there a plan that exists that's checking off what's most important to me or providing more that's what's most important to me. Okay, so that's I think something that's really important and kind of piggybacking off of that, you know, starting for the past I say few months now, our agency has kind of expanded its role a little bit. We really kind of consider the overall package of what we can provide to our clients. I know I don't want to speak for you, Tony, but I know, and you probably can agree. I know myself as also an agent, I get a lot of questions throughout the year about long-term care or cancer policies or life insurance or final expense insurance. And it became to the point where we decided collectively as, hey, it may make sense to offer that, right? To help fill these holes. So as you're thinking about your Medicare coverage, there may be things about your plan that you love, but maybe there's holes in it that you're not so fond of. I can almost guarantee there's an insurance product that would fix that for you. And it doesn't necessarily mean, hey, it's going to be this outrageously priced $160 insurance product. There are the insurance industry is very unique. They create one product to create another product to fill that hole. But there's a lot of products that don't exist, or excuse me, that do exist, that help fill the holes of where Medicare may fall short. Even for our Medicare supplement members and prescription drug plan holders, there's a benefit for services. So we work with Harry Rittner. He was a dear friend of mine. He used to oversee uh, what we call ancillary products, right? When it's more than just the healthcare plan for the entire country across the board. His specialty is everything. He understands Medicare like the back of his hand as well, but the products of how they really complement that, the life insurance, the long-term care, hospital indemnity plan, which is a must talk about if you are a Medicare Advantage plan holder, cancer, stroke, heart attack policies, anything of that sort that's more than just your Medicare supplement, prescription drug plan, Medicare Advantage plan. If that's something you're interested in hearing about, we have been very clear. Harry is more on this approach than probably I am of let's just have that educational conversation. And then from there, let you guys decide. Let you know what exists, right? Because there's nothing worse than X happened. I wish I would have known I could have had this as a potential option. Harry's all about the education. He's a lovely man. He takes his time with individuals. If this is someone or something you're interested in, please let your agent know. We do have handouts we're happy to give out. Harry's completely familiar with our process. He'd be happy to have that conversation with you. I know I am cutting my time here. I tried to tell you I'd be as quick as possible. I just have one more thing here I want to show you, and this is kind of how we as your agents are helping you out. I know in a lot of the email communications we sent out, we talked about Medicare Now. This is really to kind of help make life easier as a whole for you. And us as well. I can't deny that, but really to help make life easier for you and help kind of see what's out there. So we as an agent, each of us have our own link. This would be my link that would go out to my clients or potential clients. And I can tell that here because it says Agent Patrick Snell. And everybody has the ability to create a login. And it's really as simple as coming down to the login, hitting create account, and all you're filling out is your name and your email address. Very simple to do and creating a password. If you forget your username or password, all you got to do is either do forget username, forget password, enter your name and email, and it'll send you an email with the link to reset it. But why we're sending this out here, and I'm going to get logged in, this is a test account, is once you're logged in, so Testy Tester is my test account in here. I want to just kind of show you. Once you're logged in, you can come into enter preferences down here at the bottom. And you have the ability of entering in your providers, prescription, and pharmacies. Now I'm going to show you this information. This is not my information. I do not see these doctors, nor do I take these prescriptions. It's just to kind of show you here what's going on. You can enter in your provider information. You can enter in your prescription information, and it's even smart enough that as you're typing, it's trying to help you figure out which medication you may be taking, where you can even select the dosage, the frequency, and add it to your list of prescriptions. I just listed some heavy, typically some of the more expensive prescriptions. You can even add a pharmacy down here. Maybe you want to shop pharmacies. We can take a look at different ones, right, and see which one may be more cost effective to you. If you wanted to look at a, Walgreens versus a CVS versus a Giant Eagle, so on and so forth. But what's really cool about this program is this is shared with you and your agent. Only you and your agent have the ability to see it. I have no master account where I can go in and see everybody's information. So Tony's clients see just are shared between Tony and her, or them, I should say. But once this is all done, you as the client have the ability to hit continue. Right now, I just want to caveat that this is still showing 2024 information and will not show 2025 information until October. It's going to start here with Medicare Advantage just because that's the first, that's the first option here. And it'll show you the different plans. It'll show you ways that you can sort these out. Maybe you want to search by different providers or different deductibles or different benefits or different insurance carriers. The only thing I want to caveat here, and this is not the system's fault, and we as the agents know this, the providers here, if you show them out of network, this is where us as the agents come in. 9 times out of 10, they will. And this is every system that exists out there. We were reliant on doctors to provide updated information, and that's not always the case. But you can even have the ability to click on plan details. And you can actually see the plan in fine detail. See your estimated drug cost for the year, your grand total that includes the premium, what your co-payments would be, what the dental is going to be like. You can even scroll down to the very bottom and see all of the necessary legal documents, I should say, that's related to the plan, as far as the summary of benefits, evidence of coverage document, the star ratings. If you're a prescription drug plan holder and you wanted to take a look to see if you're have any potential of saving any money, there's a prescription drug plan tab here where you can sort by total annual estimated cost, and it'll show you the lowest cost prescription, which carrier is covering these prescriptions, what the pricing of it's going to be, including your premium, and how much you're going to spend out of pocket on drug costs. This is a way for you to kind of help share this information with your agent, make sure it's accurate. Okay. As far as this goes, this is going to be the ability to share accurate information securely. It's going to show you the plans that are competitive out there in the market. It's going and ones that we as an agency have decided to still represent and work with, as there are changes to the Medicare realm. But it's a way for you to kind of have that communication. In the event you want to compare plans, you can also do that as well. If you enroll yourself, that's fine. But I do ask that before anyone enrolls themselves, they please reach out to their agent, okay, just to make sure that they go over everything, that all the T's are being crossed and the I's are being dotted. Okay.
Patrick, you have a question in the chat.
Sure. What's up?
It is, if you may be moving out of state in 2025, is there a way to plan for that?
Yes-ish. So if you're moving out of state, I would definitely have that conversation ahead of time. Typically, what I would encourage individuals is give us about 90 days notice. That way we can help prepare for that. Moving out of state gives what we call a special election period to pick a new plan. All plans are based off of the county in which you reside in. So moving from one county to another county, even in Pennsylvania or the current state you live in, opens up that special election period because that plan may not be offered in the new county you live in. Is there a way to plan for that? Even within here, if you come in, you could even switch the zip code and you can type in any zip code you want, right? And it'll show you the plans available in this area. So if you are moving out of state and you want to take this approach yourself and just kind of get a feel of what's out there, you can still utilize this program. If you say, hey, I wasn't going to utilize Medicare now anyways, that's why I have you as the agent, well, then just reach out to us ahead of time. I deal with moves all the time into our state, out of our state, which is why we're contracted, I think at this point with 12 or licensed in 12 different states throughout the country, especially because we have so many snowbirds as well. So there is a way. I would give it, say, about 90 days ahead of time. That way, when you actually move, we have that 30 to 60-day window to actually make it happen. But you already would have known your decision, and it's as simple as just submitting an enrollment form, which is all done electronically these days. Okay, so I hope that I answered your question there. And then just lastly here, guys, I just want to recap. The changes to the Medicare program is really what's the big changes. New $2,000 limit, right? How's your plan impacted by this? Well, review your annual notice of change. Everybody gets it unless you're a Medicare supplement plan holder. There's a new Medicare prescription payment plan. It's offered to everybody on Medicare who gets their prescription through the Medicare program. But you have to think about, is that right for you? Right? It's hard for us to determine that as your agent because we have no way of spacing out those bills. But if we know you're hitting your catastrophic stage in those early months, my recommendation is probably yes. If you have Medicaid, LIS, extra help, PACE or PACE-Net, then the answer is no, right? And then lastly, and I hope this was really reiterated a good number of times, work with your agent. Call us. Feel free to. At this point, I think across the entire states and all insurance products, we're working with thousands of people across the area. Um, your agent, I can guarantee, does a great job at taking and understanding this information, knowing the products that exist with Harry and the More Than Medicare division of Health Focus Partners, can even fill those holes even more. Maybe maybe the answer to some of this annual enrollment period isn't, hey, do I need to switch my plan? Maybe the answer is, or the question really is, hey, do I need to supplement this plan? Do I need to fill in this hole of this plan? Because everything else I like about it. But there's this maybe little gap that always has me concerned. I'm going to guarantee you there's a product that exists for it, and they're very typically not very expensive at the end of the day. I think our average hospital indemnity plan averages about anywhere from $35 to $44 a month, right? Which is more, which some people pay triple, quadruple that for a standalone prescription drug plan. So just something to keep in mind. If you have any questions, please reach out to your agent. I really, again, appreciate your support with Health Focus Partners. We look forward to another annual enrollment period working with you yet again. Honestly, it makes everything very enjoyable. If anyone has questions, feel free to stay on. I'll be happy to stay for a moment if they want to put it in chat. If it's something personal or something unique to you, please send an email out to your agent directly or give them a call. If not, thank you very much for joining us. And again, thank you for your support. Lori, we're licensed in, I'm going off of memory here, so bear with me. New York, New Jersey, Delaware, South Carolina, North Carolina, Florida, California, Virginia, West Virginia, Maryland, Delaware. I don't remember if we added Ohio. Maybe Ohio. I don't know if that paperwork has been done. Is that one that we cross it off the list of one of the states? I just sent mail to South Carolina just yesterday. So perfect. Yes, I know that state very, very well. I have some two great contacts there, so we'll be happy to help you out with that. You're most welcome, Lori. You're most welcome. I always like to give people time. I maybe typing it out there. You're most welcome, Nick. Thank you for joining. We appreciate it. You're most welcome, Dad. Thanks for joining. Yes, they will have the annual notice of change as well. Well, you're actually on my list of to contact, as you can imagine, with our favorite topic from last year. But I'm writing a note to myself now. I can probably email that out to you. So don't even worry about it. I'll get you an email. Absolutely, you're most welcome. All right, guys. Well, I don't see anyone else typing out here. Again, thank you so much. If you need anything, as always, you're most welcome, Susan. Thank you so much for joining. As always, feel free to reach out to your agents directly. And here's to another successful, fun, not stressful annual enrollment period. So thank you very much, everybody. I'm going to end the meeting now.